Hi, I'm Dr. Julie Steinauer, and today I want to talk to you about what age is it appropriate to start vision therapy for your child. And secondarily, here are 3 reasons why you should do it now. Okay, let's first tell you how you can connect with us. Our phone number, if you're local, is 618-288-1489. If you're not local, go to our website at visionforlifeworks.com. You have 2 choices there. You can either fill out a questionnaire and just get some general feedback about the questions you answered, or if you have some very specific things that need to be answered and you're ready to just move forward with, what can we do to help you, then schedule a consultation. Okay, so now let's go back and talk about what age is appropriate to start therapy. Any age. If you notice there's a problem, that's the age that's appropriate to start therapy. Now, there are some offices that say, well, they don't see or examine kids unless they're age 5 or 6 or 10 or whatever it is. There's no magic number for our office, and for really any office that's providing any kind of therapeutic intervention. There shouldn't be, we don't want to see your kid until they're older, because we want to intervene at an earlier time. So now let's tell you the 3 reasons why we say, okay, well, let's do it now. All right, so do you want your vision problem for your child corrected now? Or do you want to wait and say, deal with that a couple of years down the road? Like, how fast do you want this to actually be changed? So it's appropriate, number 1, to do it as quickly as possible, because you should want it to be changed as fast as you possibly can, of course. And so we work with kids who are starting at age 6 months. We work with kids that are a year old, 2 years old, 3 years old, 5 years old. There's no age range from 6 months to, kind of almost cradle to grave. We work from 6 months old, so there's no upper end in terms of the age limit. Okay, so the second reason why, kind of just do it now, right? If you're asking this question and you're wanting to have guidance and direction, you're probably already thinking your child needs some help, and so it's appropriate to move forward. So the number 2 reason I'm going to give is nip it in the bud now. You ever heard that? Just kind of nip that problem and don't let it go any farther, because it could potentially become more of an issue down the road. The visual problem may get worse. Things may become, more difficult to try to correct. So if you don't address it early, then you may have a bigger problem to deal with later. Now, the 3rd reason also is somewhat similar to this, but you may have other things that come into play down the road if you don't kind of get rid of it or work on that problem and resolve it early on. And those things could be, well, it might affect the child's ability to read. It might affect their ability to perform in a classroom. Maybe it affects their ability to comprehend or to spell. So these are things, or maybe affects their coordination of their body. So there are all kinds of things that could be a result of not dealing with the visual problem early. And, as far as, do you want that sort of thing to crop up for your child? If, they're happy, they're doing well, and, they're loving life and they're loving school, and you find this problem, and then what if, a year or 2 down the road, it doesn't get kind of nipped and corrected, and now all of a sudden they hate school, they hate reading, they don't, so you want to try to address it at an earlier phase when it's not showing really ugly signs of this is a huge problem that is causing your child maybe even to feel bad about themselves, or feel like, they're not good enough, or what's wrong with me because I can't read as well as someone else. So it's always, I think, prudent to do the intervention at an earlier time frame. So those are my 3 reasons why, if you're the one asking when should you do vision therapy, the answer is now. All right, so if you like the video, hit the like button. If you haven't done so, please subscribe so you don't miss any of our videos. And obviously, if you feel like this could be helpful or beneficial, please pass it on to someone else. Thank you.